Good afternoon, everybody. My name is Esma Day. I'm an impact manager with BARHII and Rise Together. It's great to have you all here today. We have quite a tight agenda, so we're going to try and fly through some introduction and welcome before we get started. So you're joining a webinar today on new Bay Area County powers to enact emergency sick leave in light of COVID-19. And we're joined by 4 panelists today who will be giving around 10 minutes of presentations, followed by quick Q&As after each presentation. And then we'll open up the floor for Q&A and discussion at the very end. And I'll start with the greeting of a greeting that you all have been very familiar with in the past few months, and that is, can everybody hear me okay? Thumbs up or... Great, awesome. Okay, some logistics before we jump in. I'm sure a lot of you have been maybe too familiar with Zoom recently, but just to go over some things that might help facilitate the discussion today. So a lot of you have seen, have already used the thumbs up, that's great. If you wanna kind of back up or support something that is being said, you can hover your mouse to the bottom of your screen and you should see a reactions button. If you click on that, you'll see a thumbs up or a clap, and feel free to use any of those. It'll be great if you have your cameras on. I know it's a Friday afternoon and lunchtime for a lot of you, so that's totally understandable, but it would be great to see who's all on the line. And then we have a little feature. If you hover down to the bottom right of your screen and see participants there, if you click on it, you'll see a raise hand function. If at any point in the discussion today, people are kind of talking over each other, you're not quite getting to your question, feel free to use that feature and we'll try to catch you in your question. And last but not least, feel free to use the chat function throughout the presentations to ask a question or make a comment so that we can get to that when the presenter is done. Again, we'll have 2 different opportunities for you all to share your questions and comments. One right after the speaker goes and one at the very end of our webinar today. Any questions about logistics? I think I'm hearing an echo and maybe somebody didn't mute themselves. Okay. Awesome, I see someone's managing little ones and distracted. That's okay. I think we're all needing to get used to that reality. Thanks for letting us know. Okay, so we have a lot of folks on the line who may be new to BARHII and Rise Together and what we do. So a little bit of an introduction. BARHII is the coalition of the county public health departments in the Bay Area. Recently, Rise Together joined our team as a economic opportunity coalition, and they've been largely focused on ending poverty. And together we've been working to advance quite rapidly a lot of response efforts to COVID-19 using our 3 pillars or guiding principles, which are health equity, economic opportunity, and racial justice. A lot of you have been familiar with a lot of our work, but if you haven't been, we recently put on quite a few webinars on different topics that the group collectively decided on as priority actions to respond to and recover from COVID-19. And so we have a living document that is our platform of policy priorities that we have been very aggressively pursuing. And one of those is paid sick leave or paid protections for workers. And so that's kind of what this webinar is building on today. And we're very excited to have an esteemed group of folks with us today, experts from the field who have helped to push a lot of emergency paid sick leave ordinances throughout the Bay, and then as well as Change Labs, who's going to be talking about more of the county powers that have now been introduced to the area given the emergency. So our mission is to transform public health practice for the purpose of eliminating health inequities using a broad spectrum of approaches that create healthy communities. And how that manifests is through what we do. A lot of you are familiar with one of the 3 things, maybe, or 2 of the 3 things, depending on how you've worked with us before, but we actually have a whole host of ways that we reach out to our community our partners and our members. One is through white papers, and these act as foundations for the case making for health equity for any policy that is to be pushed forth in the Bay Area. And so as an example of this, a lot of you have been familiar with our housing work in Vallejo. We did a lot of case making for that and really rallied the group around the region, a lot of key stakeholders together to make the case for health equity within housing to help push for an equitable response in Vallejo for stable housing for folks. Second, a lot of you have been familiar with a lot of our trainings, particularly post or pre-COVID-19. We have a whole host of ways that we engage our group in technical assistance and training that covers everything from a bias in the workplace to looking at how to enact equity within structures, both in government and non-government. And finally, last but not least, technical assistance. So any support that you all need, we have a lot of great connections with key media and communications groups that have helped make the case and translate the work of health equity into action as well. And so our approach is largely defined by taking systematic problems and applying systematic solutions to them. It's not enough that we understand the problem and that we state it and report on it through our data and our research, but we actually implement equity tangibly. And how we do that is through transformative health equity policy, because we understand the importance of policy in opening up avenues to allow health equity to actually take place and take form, not only in a timely manner, but in an effective manner as well. We follow that with building power with affected communities, because we understand the importance of the power dynamics that happen in different societies, and that unless a community has the power to lift itself up, then it doesn't matter how many policies we enact. Their solutions are never going to be aligned with their needs. And then we also follow that with strong implementation in all 9 counties. And what that means is that we like to rally the entire region as opposed to focusing on 1 or 2 regions to either help support one region or enact and align policies across the entire region to make a strong case for that policy or that movement that we are rallying around. And the vision behind that is, after we do all of that, that we have an equitable Bay Area, and this continues to be our North Star for our work. So for anyone who's interested, some ways that you can get involved and how you can call on us to support you is through data. Like I mentioned, we have a lot of white papers that we have been doing, a lot of briefs that we've been putting out. Recently with COVID-19, we've been working a lot with actually paid sick leave and workers' rights, in addition to stable housing in the region, working on eviction moratoria, things like that. Secondly, communications. As I mentioned, we have relationships with media groups through crafting op-eds or other articles. You can reach out to us for that. And particularly for this topic today on any paid leave campaigns that you're working on. And last but not least, power building for community partners, whether that's through town halls, presentations, things like that. We have a really strong record of presentations and appearances that we've made in the past to help do this. So again, please get involved. Beyond all the reasons that, or the ways that you can get involved that I mentioned, we have cohorts and committees that you can join if you're interested. We have 2 committees currently, the data committee and the policy committee. We also have 2 cohorts that are basically a group of leaders that come together at the table and strategize around different things. So one is the leading change cohort, and second is the healthy, resilient housing cohort. And bring us your concerns. If anything that I mentioned isn't really covered in what you're thinking about, we'd love to hear about it. We continue to shift and grow and kind of adapt depending on what the region's needs are. Any questions before we delve into our topic today about anything that I just said? And feel free to ask later as well. Okay, so for today, I have a packed agenda, as you can see. The objectives for this meeting are to share some local health officer authorities that have been identified through a lot of research by Change Lab Solutions. That's really exciting for this time. We know that at the state and federal level, the emergency paid sick leave and paid family leave that have been passed are not all-encompassing, they have left out and carved out a large portion of the population. And so these are some ways that you as jurisdictions, cities, counties can get involved without waiting for bigger change to happen at the state, even though it's really important for us to focus on larger campaigns that we can all get involved in. We're also going to cover that as well. And then we'll provide some examples and technical assistance on 2 counties or 2 jurisdictions that have passed ordinances recently, and what they have learned through challenges, through wins, and what you all can take from them as well and pose as questions to them as well. And so a quick note about why we were thinking about paid sick leave to begin with as a priority. We know that about 66% of all essential workers right now during the pandemic are workers of color in the Bay. And so this is widely, and importantly, an equity issue. And so we wanted to get a head start on it as we saw jurisdictions kind of struggling to think through how they can pass their own paid sick leave ordinances. We saw that there are some barriers to doing so. And so we rallied the best thinking in the region to offer some support in that. And as I mentioned, there have been gaps that you all, I'm sure, are aware of on the federal and state level for this as well. And of course, given that we are public health focused, we know that the health lens for paid sick leave and the health case is really easily made. We see from previous pandemics that not having sufficient paid sick leave or paid leave in general has been a health hazard, and a lot of a huge portion of infections and death rates have been attributed directly to not having sufficient paid leave in the past through H1N1 and other pandemics that we've seen. So without further ado, I'd like to introduce our first speaker. We have with us Derek. Derek, are you on the line?
I am.
Awesome. Derek joins us as the senior attorney for ChangeLab Solutions, and he's been behind a lot of the great work that's been happening to determine what are the new county powers for paid leave. So thank you, Derek, for joining us today, and please take it away. And would you like me to share your slides, or?
If you stop sharing, I can share my screen.
Okay, great, I can do that.
And of course, the usual tech issues. There we go. Can you see the slides? Are you able to see the slides? So yes?
Yes, we are. Yep.
Great. Awesome. Thank you for the introduction. I'm glad to be here today to talk about this important effort. So for those of you who haven't worked with us before, ChangeLab Solutions is a national nonprofit located here in Oakland, California, and we work across the nation to advance equitable laws and policies that ensure healthy life for all. And I am a lawyer, so of course I have to start with a disclaimer. ChangeLab Solutions does not provide legal advice or enter into attorney-client relationships. So the content of my presentation today is strictly for informational purposes. And if you have specific legal questions, we recommend that you consult with an attorney licensed to practice in your jurisdiction. So before jumping into the discussion on legal authority, I wanted to just do some level setting to make sure that we're all working from a shared understanding of the differences between paid sick leave and paid family leave. So paid sick leave are laws that require employers to provide people to take paid time off for illness or injury for themselves or their family members. And policies vary based on how many family members and what size employer are covered by the law, as well as the number of hours that people can earn. And then paid family leave is a generic term referring to a variety of government or employer-sponsored paid leave policies, including parental leave, adoptive family leave, which really allow parents to take time off to care for their newborn and young children, and it's generally over a longer period of time than sick leave. So with that in mind, what is the general legal authority of local governments and local health officers in California? That is, what can they do on a day-to-day basis, even outside the context of the current crisis? So under the California State Constitution, counties and cities are authorized to enact and enforce, quote unquote, all local police, sanitary, and other ordinances and regulations. So what this effectively means is that cities and counties, through their governing bodies, have really broad authority to regulate for public health and safety. Now, of course, the local government can't usually adopt any laws that conflict with state law, but it's also important to note that local laws that go above and beyond state law, so those providing additional benefits or protections, generally don't constitute a conflict with state law. And additionally, laws and policies adopted by counties, such as ordinances adopted by a board of supervisors, apply only within the unincorporated areas of the county, not within incorporated cities. And that's an important point that I'll come back to in a moment. And then, of course, local health officers are, play a critical role in lifting up the public health issues and providing recommendations for local action, as well as some more, direct authority over things like isolation and quarantine and stay at home. But in general, outside the context of an emergency, their direct regulatory authority is a little bit more limited. But the legal authorities available to both local governing bodies, city councils, county board of supervisors, and local health officers expands pretty significantly during declared emergencies. So that's whether that's a local emergency declared by a county board of supervisors or city council, or a state of emergency declared by the governor. So during a declared emergency, state law authorizes local health officers to take any preventive measure that may be necessary to protect the public health from any public health hazard. Similarly, local governing bodies are authorized to issue orders and regulations necessary to provide for the protection of life and property. And of course, both of these grants of authority are quite broad based on their wording alone. And then, as I mentioned on the last slide, county laws typically only apply within the unincorporated areas of the county and not within incorporated cities. But there is a legal opinion from the California Office of the Attorney General that was issued in 1979 that concluded that during a declared emergency, counties are authorized to adopt regulations that apply within incorporated cities. And in the context of COVID-19, we know that many Bay Area counties have relied on this Attorney General opinion when adopting eviction moratoriums that apply throughout the entire geographic area of the county. And I do want to add a note of caution on that, though. State Attorney General opinions are not legally binding documents, and courts can and often do reach contrary conclusions. So while there's a lot of considerable weight that are afforded to the Attorney General opinions, and they can really help guide decision-making in unsettled areas of the law, like emergency powers, we can't really predict how a particular court would come down on the question of specific county emergency orders that purport to apply within incorporated cities. And then the other aspect of it is, of course, any additional authority that a county board of supervisors has to regulate conduct within the incorporated cities is strictly limited to the duration of the declared emergency. So what does this look like specifically in the context of local paid sick leave policies? First, California's state paid sick leave law includes explicit language allowing local governments to adopt more comprehensive policies that provide for greater accrual or use by employees of sick days, or that extend other protections to employees. Second, although local health officers may have sufficient authority to unilaterally expand emergency paid sick leave benefits for the duration of the declared emergency, such action would really be unprecedented, and there's a possibility that it would run up against both legal and political challenges. In contrast to that, cities and counties acting through either the city council or the county board of supervisors have very clear authority to expand paid sick leave benefits, both in the context of an emergency and just through their general powers. And then finally, as I mentioned, there is the possibility that emergency paid sick leave policies adopted by a county could apply within incorporated cities, but this is really a legally untested route, and the policy applicability within those incorporated cities would be limited to the duration of the declared emergency. So that really leaves us with three options for expanding paid sick leave at the local level here in California. The first and most clearly permissible approach is to adopt separate policies in each jurisdiction through the respective local governing body. So, county boards of supervisors adopt policies applicable within the unincorporated area. City councils adopt, similar or other policies applicable within each of their respective cities. And this approach is also, valuable because it allows for the expanded paid sick leave benefits to remain in effect even after emergency declarations are lifted or expire. We all know how difficult it is to get these policies in place quickly when the unexpected happens. The second option is for county boards of supervisors to adopt an emergency paid sick leave law that applies within both the unincorporated and incorporated areas of the counties. But as I've mentioned, this approach may carry a little bit greater legal risk because it's just an untested approach, but there are certainly strong arguments supporting county authority to do this. And then finally, the third option, which presents both the greatest legal and political challenges for local health officers to take unilateral action to expand paid sick leave, but that still remains an option for those sort of looking to push the envelope. And regardless of which approach is taken, there are a few considerations to keep in mind. The first is, as with all laws and policies, it's critical to establish a robust record that clearly outlines the evidence supporting the paid sick leave benefits, including why existing federal and state benefits are insufficient to address current needs. Second, the policy should clearly indicate that the strongest available protections apply. So what I mean by this is if a county adopts a paid sick leave law and then a city within that county adopts an even stronger law, the residents within that city should be able to get the full benefits of the stronger city ordinance. And then for emergency policies in particular, it's also important to establish time periods to periodically reassess the policy. So, asking the questions around whether the policy is still justified based on current conditions, did it have its intended effects? Are there areas that need to be revised or tweaked in order to maximize the public health benefits? And of course, there should always be proactive consultation and coordination among different levels of government, especially those going sort of the option 2 or 3, where you have one level of government passing a policy that applies to another level of government, as well as with the various stakeholders. So before opening things up for questions, I want to highlight some of the resources that can help inform your efforts. The memo hyperlink on this slide is something that we put together through our collaboration with BARHII and provides an overview of the general and emergency powers of local health officers and local governments in California, including specific suggestions and considerations related to paid sick leave, eviction moratoriums, essential workers, and criminal justice settings. And it also outlines opportunities to leverage the COVID-19 response efforts into long-term changes that can aid in recovery and beyond. And there are also several other relevant free resources available on the Change Lab Solutions website, including our recent blog series focused on how local governments can center public health and health equity in COVID-19 response and recovery efforts. So with that, I am happy to answer any questions, and to the extent that we don't get to all of the questions today, please feel free to follow up with me by email.
Great, thank you, Derek. We'll open it up for about 5 minutes of questions. I see a question in the chat.
What constitutes a robust record? That is a great question, and it's a little subjective. Certainly you just want to put forward, enough evidence to, if someone was looking at the policy, that they could show that it is, justified by the evidence. This is really easy in the context of paid sick leave, as Asma was saying in the introduction, like the evidence on the public health benefits of having paid sick leave and the public health harms that result from not having it are fairly well established. So just really making sure that the policy that you're putting in place is referencing those that research and really clearly drawing the connections between why these policies are necessary in order to protect public health. It doesn't, there's no like you have to have at least 20 pages here or a minimum word count or anything like that.
I received another question that is, what is the legal argument that could be brought up that could challenge local authority to enact paid sick leave?
Yeah, so it depends on sort of the route that is taken. So with respect to like option one that I had mentioned around each city and each county adopting their own policy, as long as it's at least as strong as state and federal law, there aren't really a ton of arguments that can be made against it. The legal authority is fairly clear there, assuming it's drafted in with best practices and things of that nature. For county emergency powers, attempting to pass a county law that applies within an incorporated city, it's possible that either a business within the city or the city itself, depending on politics, could challenge the ability of the county to impose regulations within them. They're separate political and legal entities, and it's as I said, the default rule is that it doesn't apply within there, and so it's a question of does the state emergency response laws provide sufficient authority for counties to, within an emergency, override the otherwise default rule. And there's strong arguments favoring that, but until we actually have a court that says interprets the law one way or the other, there's always a risk. And then with health officers, the challenge comes in that health officers only have those powers that are specifically delegated to it by the state legislature, unlike cities and counties which have power that they derive from the state constitution. And so with local health officers, you really need to fit within the authorization that state law provides. And while the powers granted by state law to local health officers are really broad, I think it's certainly a true statement to say that like things like paid sick leave and eviction workrooms are not what the state legislature had in mind when they passed the authority for local health officers. It was those were things policies that weren't even on the radar at that point. And so there's the question of how far a court is willing to, how broadly a court would be willing to read into those emergency powers. And so that presents sort of an unknown, whereas the authority on the city and county side is much more concrete.
Thank you, Derek. I think we're hearing some background noise, so if folks are not muted, please mute yourselves if you're not speaking. I think we have one more question from the chat, and then we will move on.
If an employer does not have sick leave, how quickly can it be put in place for an individual who gets a positive test, and will it be retroactive? That's a great question. On the retroactivity part, I will punt on that. Something I would have to do further research on, and so not something that I want to provide an answer to off the top of my head. In terms of how quickly it can be put into place, generally when ordinances are passed, they can't go into effect for 30 days. But in the context of an emergency, there are, if the city sets forth the findings as to why it's important for public health to go into effect immediately, they can pass it as an emergency ordinance, and it would go into effect as soon as the city council or the county board of supervisors votes in favor of it. Yes, seeing the message, we tried to make the Oakland ordinance retroactive, and the city attorney said we couldn't do it. So they have good city attorneys, so I would assume that is a accurate response.
Wonderful. Thank you so much, Derek, for that really informative presentation. And as Derek mentioned, you all can reach out to him via email. We'll also be circulating the slides that he shared with the resources after this webinar. Okay. Next, I have with us Katie, who is the Political Organizing Director at the California Work and Family Coalition. Katie, I see you. Can you hear us okay?
Yes, can you hear me?
Yes, we can hear you. I will share your slides in just a second.
Thank you for doing that.
Yeah. And if you want to say a bit more about yourself or the
Sure.
coalition while I pull it up.
I will absolutely do that. And I also just want to make clear that I am not a lawyer, so all of my information will be informational only, but I am have a couple of slides with resources to free clinics and helplines that you all can call if you encounter anyone who does need legal advice. And then at the California Work and Family Coalition, we work on both trainings and so that people know their rights and understand what they're currently entitled to in terms of paid sick days and paid leave. And then we also advocate for improvements in the laws. So we kind of work on both ends. And we recently did a 3-part webinar series that goes into much more depth about the laws and programs that I'm going to discuss today. And those recordings are available on our website. So I would just invite you all to check those out. So when we're looking at paid leave in the time of COVID-19, I don't think that any of the information on this slide will be news to you, but COVID-19 is really exposing all of the gaps in our protections for paid sick days and paid leave and showing that our policies are really out of step with what people need. They remain largely unchanged. There's been some really amazing actions at the local level to pass emergency paid sick leave, and the federal government has passed some laws as well. But even what has currently been passed still has gaps. Next. So this is just a little bit of information about the California Work and Family Coalition. Next. So I'm not going to go into a whole lot of depth about paid family leave laws, but I do think it's helpful to understand that we have leave laws in the state of California, and the two sort of systems that you need to navigate in order to access paid leave, which is typically, as Derek said, for a longer period of time, either for your own serious illness, to bond with a new child, or to care for another family member. Many people are unaware of this, but you can take paid family leave to care for your spouse, your parent, and we're working on including other family members as well. So the two concepts you want to keep in mind with paid family leave is you need to both figure out how to have job protection, which requires your employer to hold your job for you while you're out on leave, and figure out income replacement. Next. So as you can see, job protection is a very complex process. This is one of the big barriers that we see to people being able to take leave. What it essentially boils down to is if you have worked at your employer for more than a year, you've worked at least 1,250 hours, and if you're a new parent, your employer has at least 20 employees in a 75-mile radius, or if you're a caregiver, at least 50 employees in a 75-mile radius, then your employer is required to hold your job for you for up to 12 weeks. Next slide. So that's the job protection piece. Wage replacement is a completely different program. We all pay, private employees, I should say, not public employees typically, pay into the SDI fund. So if you pay into that fund on your pay stubs, that is the money that you may be entitled to for paid family leave, and you apply for that through the Employment Development Department. What paid family leave does is it replaces 60 to 70% of your pay for up to 6 weeks. And actually, as of July 1st, 2020, that will be extended to 8 weeks. Paid sick days are kind of a combination of both job protection and wage replacement in one law. Next. So what our current law provides for is that state laws that California workers who work 30 or more days within a year must be given up to a minimum of 3 paid sick days. So your employer can always choose to give you more paid sick days, but legally the minimum is 3 paid sick days. Those paid sick days can be used to care for your own illness, to care for a family member. It includes the diagnosis, care, or treatment of an existing health condition or preventative care. And they can also be used to seek care services related to domestic violence, assault, or stalking. Next slide, please. So as you can see, our existing state law really doesn't even allow us to follow the public health directives about quarantining with coronavirus, because if you say you've already used even one of your paid sick days this year, you might be down to 2. And so the federal government has passed some emergency paid sick leave provisions, and as well as emergency medical leave, although you'll see when we start talking about those laws that there are still a lot of gaps. Next. So I'm actually going to talk about some of the limitations first before we even talk about what these laws cover. So the Families First Coronavirus Response Act expires at the end of this year. It only covers employers with fewer than 500 employees. So it leaves out all of the largest employers in our country. Amazon, Safeway, you know, any like large employer that you can pretty much imagine, like they are not required to provide these paid sick days. And then another thing to know is just that the employee must be unable to telework. Next. So again, who is left out only covers employers with fewer than 500 employees. Workers in the healthcare industry are not covered by this law. So really insane to think about. In a public health crisis, not workers in the healthcare industry may not be entitled to more than these 3 paid sick days. First responders are also not covered, and in some estimates, 80% of the California workforce is still left out of the federal law, which again expires at the end of the year. So if this crisis persists past December, all of these protections will go away. Next. So what is actually in the law? You can have up to 2 weeks of paid sick leave, and what this really is in the law is 80 hours. So it's designed to be 2 work weeks, not 14 days, at 100% of your pay if the employee is under quarantine or isolation order from a government entity, or they've been advised to self-quarantine by a healthcare provider. The amount of pay maxes out at $511 per day or $5,100 over the period of paid sick time. If you need paid sick leave to care for someone, then you will only receive 2/3 wage replacement. It's the similar 80 hours, and it would be to care for someone subject to a quarantine or an isolation order, or a child whose school or child care facility is closed. And this pay maxes out at $200 a day or $2,000 over the paid sick period. Next. There's also been an expansion of emergency family and medical leave, which could provide up to an additional 10 weeks of leave at 2/3 of wages when the worker is unable to work or telework due to closure of a school or a child care provider. Next. I did just also want to highlight, because this is one of the most common questions that we receive, which of these laws apply to undocumented workers. 1 in every 10 workers in California is undocumented. And citizenship and immigration status do not affect eligibility for state disability insurance and paid family leave. Eligibility is based on your SDI contributions. So there are certainly considerations with applying, and it's helpful to be able to refer someone to a legal resource, but purely based on eligibility, they just want to know if you paid into the fund, essentially. For paid sick days, similarly, workers qualify for paid sick days regardless of immigration status. This is common sense, but don't share someone's immigration status if you are educating them about their rights and you happen to learn it. And then there are also some anti-retaliation laws if your employer threatens you based on your real or perceived immigration status. Next. So obviously, as we talk about this, there are some gaps. There's a couple of pieces of legislation that we are looking at right now. I want to be really clear that, laws can change. So this is what is written in the law at this moment, but that doesn't mean that if it works its way through the legislature, that's what it ultimately is going to say. But there's been a bill proposed at the statewide level with 3216, which would provide 80 hours of supplemental paid sick days to all California workers in public emergencies. It would expand job protection to all employers regardless of size. And it would also provide a right of recall and retention for workers who've been laid off in particular industries that have been really hard hit by COVID-19. So this bill has a lot in it, and it's designed to try and address some of the big issues that we're seeing right now. Next. So we also are keeping an eye on SB 1383 and supporting this. Again, as it's currently written, it would provide job protected leave to parents whose have children, school, or childcare facility is closed. We know a lot of people are forced to decide essentially between continuing to work or leaving their children alone at home right now. And so this bill is trying to address that concern. Next. And then this is just a really interesting year. So some of this exact same provisions that are in AB 3216 again, as it's written right now, are also in the governor's budget trailer bill to expand job protection. So I wanted to highlight that as well. There's two potential mechanisms that could address this particular barrier. And currently 40% of California workers can be fired if they need to take care of a seriously ill family member, purely based on the size of their employer. And this is regardless of if people are already paying into the fund. So folks are paying into the fund and then can't access this benefit because they don't have job protection. And not surprisingly, when the EDD surveyed folks, a top reason for not using paid family leave was job loss, fear of job loss. Next. Oh, sorry, that was a repeat. You can skip that. And maybe, all right, here we go. So advocating for change, right? Our laws don't reflect our lived reality. Our vision is that we have universal protections for people to be able to work and care for their family, and we are clearly a long way away from that. There's going to be some great speakers talking about action on the city level, what we look at more as the state level. So we invite you all to join us in our work, speaking with legislators and educating them about these issues. Next. And then I did want to also provide you with some resources. A lot of times what happens when we discuss these laws is people feel very overwhelmed and feel like they have to memorize all of the particular aspects. That is not the goal. If you are somebody in your community, you can help point people in the right direction. So I wanted to give you all some helpful resources. The Family Values at Work resources are great about the new coronavirus laws that have been passed at the federal level. They have a decision tree that's really helpful and on fact sheets that cover paid leave and unemployment insurance, and they're available in English and Spanish. Legal Aid at Work also has resources that are more specific to California state law, and these are all handouts that are specific to particular situations. They're also available in Spanish, Chinese, and some other languages as well. And then we're working on a train the trainer toolkit that should be available soon. Next. So there's some folks that have started mutual aid funds for undocumented workers. And as I'm sure all of you are aware, there are these one-time cash payment programs that have had some challenges, but do provide some cash payments to undocumented workers. Next. So what do you do if you encounter someone who needs legal support? We've got a couple of different options here. There are helplines that folks can call that are free, and then they can get confidential legal advice. So if you're ever unsure of someone's protection or someone is telling you something that doesn't sound right, like their employer told them they don't have paid sick days or something like that, you can always refer folks to a legal resource. So that's it. Thank you very much.
Thank you so much, Katie. Any questions for Katie? I know earlier someone had asked where they could find resources to support and sign on to any of these campaigns that are happening. And I'm guessing that's just on the California Work and Family Coalition's website for advocacy.
Right, so we're doing statewide level advocacy. I know other folks on the call are doing citywide level advocacy, so feel free to partner with them on city ordinances, but statewide, yes, the workfamilyca.org/advocate website is the best place to sign up for that. And as I mentioned, we do have a series of recorded webinars that go into a lot more depth about these laws that are posted on our website if you want to just fully immerse yourself in all of our paid sick days and paid leave laws.
Awesome. I'm seeing two questions come in through the chat. The first is, who has registered opposition to either of the bills mentioned or the governor's trailer bill?
The Chamber of Commerce registered opposition. They have labeled AB 3216 a job killer, and I think there are just a lot of concerns right now about burdens being placed on smaller employers because small businesses have already been hit so hard. And I would just say that, you know, as we think about reopening, if we're not protecting our workers, and we will never stop the spread of this virus, right? Like, I was in a legislative visit yesterday and today where we were talking about, you know, people on the call had personally known workers who knew they had coronavirus and had no other option but to go to work. So, but yes, we are encountering opposition. And then I see a question in the chat, how many of these resources require computer access? Yeah, so the helplines you can just call. You don't need computer access. And a number of the handouts that I listed on the Legal Aid at Work handouts, you could print out and use if you're seeing patients, for instance, in a clinic setting. I know one of them, when I was a lactation consultant working at a hospital, we just put the basic handout in our discharge packet so everybody could have access to that information.
I have a question for Katie. This is Zabre with the Economic Mobility Collaborative. Going back to the point about employers, I think that's an important one. And I missed the very beginning of your presentation. I'm sorry, so you may also have addressed this, but how, I mean, if you're talking about small to medium-sized employers, they are already seriously stretched. And so we need policies that do all of the things that you described for workers without putting their employer out of business in the process. So has there been a discussion about how to, I mean, the burden of the increased cost that is appropriate for society to bear? Has there been a discussion of how to distribute that perhaps in a way that doesn't risk putting these small to medium-sized employers out of business in the process?
For sure. So specifically with paid leave, it's actually a very low cost to provide job protection. We worked with some small business organizations that have done polling of their members because they don't have to pay for the paid family leave program. That's entirely worker funded. So the job protection piece is just, you know, that they would give their employee their job back when they're off leave. So there, you know, there can be some costs associated with trying to replace that work while they're out. Paid sick days, I think other folks have raised that. And so there are definitely some conversations happening about, you know, how to make sure that small employers don't have an undue burden. At the same time, I think it's, you know, important to consider, you know, again, like how can we really reopen if we don't have these kinds of policies in place? But yeah, I'd be happy to follow up with you offline about some more data that specifically addresses those concerns, if that's helpful.
Yeah, that'd be great. And it shouldn't be about whether or not to do the things that you're describing. It should be about how to do it in a way that doesn't just shift the pain to another sector of the economy where that's not going to leave us any better off.
Right, right.
Right, and I think we have one more question. To what extent are workers knowledgeable about FFRCA and what are the inequities? Sounds like this is an awareness question.
Yes, I have found in my experience that many workers are unaware of our existing paid sick days. I think that's true about the emergency legislation as well. It's also true about paid family leave. If any of you were feeling confused just as I was going through my slides, you know, I think that's a really common response when we do trainings. I know that for us, we've made a real effort to try and do webinars in both English and Spanish right now to try and address that. But that is certainly, I think that's one of the biggest barriers to being able to enforce these laws, is that awareness is very low. And so we work with a lot of different organizations that are doing worker organizing or in the community, or work with caregivers and new parents to try and get this information out there.
Great, and I think the second part to that was about the inequity. So are certain sectors of workers more aware than others, or demographic?
Sorry, so we do have some data about that, mostly about paid leave in general. People of color are less likely to be aware of paid leave than white people. There are pretty stark disparities in awareness along income as well. So the lowest income households are much less likely to know about paid leave versus higher income households. It's also true that there are disparities by education level. People with a high school education are are much less likely to be aware than folks with a graduate degree. And then we also know that people whose primary language that they speak is not, if it's not English, they're less likely to be aware. So yes, there are a lot of disparities in awareness.
Great, thank you. Well, thank you so much. That was very helpful for me, I know, as I'm sure it was for a lot of people on this call today. So I appreciate you being here, Katie. Thank you.
Thanks for having me.
Great. Okay, next up we have with us Divya. Divya, are you on the line? If you are, I can't hear you. Maybe try unmuting yourself. Divya, can you hear me? I see you're unmuted, but I don't hear you.
Can you all hear me now?
Yes, yes, we can.
Okay, let me just hang
Hi.
up on my phone so there's
Okay.
no echo. Okay,
Great.
there's no echo now, right?
Nope, you're fine. So Divya is with us from Working East Bay, or eBase, and she's a lead strategic researcher, and she'll actually be going through a very great case study in passing emergency sick leave in their region. So take it away, Divya, and would you like me to share your screens on my, or your slides on my screen?
I can go ahead and share my screen.
Okay, I'll stop sharing mine.
Okay, great. So hi everyone, my name is Divya. I work for an economic justice organization called East Bay Alliance for Sustainable Economy. We do mostly worker justice work and equitable development work in Oakland and Emeryville, and we do tenant organizing and immigrant rights work in Contra Costa County. And so today I'm going to be talking about the emergency paid sick leave ordinance we passed in Oakland on May 12th. And I guess I'll start a little bit by just talking about process. And I don't have a slide on process, but I'll just say a few words. So when the shelter in place order came down, we got together with a bunch of our worker center partners and union partners, as well as policy organizations, and came up with a list of 7 essential worker demands. And so these were based on what we were seeing on the ground with workers in primarily low-wage industries. And then we went through a process of basically triaging and figuring out like what we felt, which of these demands we felt were most urgent and that we could pass like most quickly. And so emergency paid sick leave was on the top of this list. And so the organizing that happened around this effort was largely led by worker centers and unions, but also we pulled in partners that we should be working together more often, but we don't. But this provided us an opportunity to pull in public health organizations, occupational health and safety organizations, as well as friendly small businesses who could speak to the ways in which emergency paid sick leave is absolutely essential to businesses being able to get back up on their feet. So in that way, I think it was a little bit of a departure from how we typically approach organizing for like legislative change in Oakland. So I will go through, this is not, okay. So I'll go through a little bit of just like the details of the Oakland paid sick leave ordinance, emergency paid sick leave ordinance. I guess it's worth saying that Oakland already has a paid sick leave policy that is based on accrual. And so we wrote this law to both track with our existing paid sick leave policy as well as with the FFCRA. And so the basic kind of overview is that similar to the FFCRA, our ordinance requires that employers provide full-time workers with 80 hours of immediate emergency paid sick leave and part-time workers with the amount of hours that's equivalent to 2 weeks worth of work. So our law went into effect May 12th. It was an emergency ordinance, so it went into effect immediately, and it sunsets December 31st, which is the sunset date for the FFCRA. And we wrote it so that the city council can pretty easily renew it if we find that that's necessary. In terms of covered employers, so our law applies to all employers that have over 50 employees. And so it fills that crucial gap in the FFCRA, which exempts employers with more than 500 workers globally. And then in addition to that, the law also covers franchises. And so this includes fast food restaurants, hotel franchises, as well as unregistered janitorial companies of any size. And our rationale for this is that, as I'll talk about later, much to our chagrin, the ordinance ended up exempting employers with less than 50 employees out of concerns for small businesses. And we felt that while many small businesses are suffering because of the kind of economic burdens of shelter in place, franchises have the support of their franchisor. And so we felt like it was, and they often set the kind of lowest bar for labor standards. And so we felt like it was really important to include them in this ordinance. So a franchise, even if it is technically considered a small business that has less than 50 workers, is still covered under this ordinance. The law includes misclassified workers and gig workers who are left out of the federal legislation. And it also includes teleworkers, which are included in the federal legislation, but are not included in some of the other local ordinances. And again, the rationale here is that, even if you can work from home, you should have access to leave. We expand the definition of family member beyond the FFCRA to accommodate the diversity of caretaking relationships in this current moment. I can talk about the particulars of that if folks are interested. We require employers to pay out accrued paid sick leave prior to laying off workers. So what that means is that the law requires all employers to give workers 80 hours of paid sick leave. That's one bucket, policy area that this ordinance. And then this ordinance also covers for workers who are getting laid off, any paid sick leave that they have accrued up till that point must be paid out. And it was just our way, it's a small bucket of money, but for many workers, it can be really crucial, especially low wage workers. And then the three major, I think, interventions that the ordinance makes is that it expands the uses of emergency paid sick leave, and it requires that for the most part, a doctor's note is not needed. It closes what we've been calling the caretaking gap. As Kathy mentioned, and I'll talk about more, for certain uses of emergency paid sick leave, the federal law only replaces 66% of a worker's wage. And so we require that across the board, employers have to replace your wages at 100%. And then we do something similar with the compensation cap. I'll talk about both of these in greater detail in a second. And then finally, require and put in place a local enforcement regime that aligns with the enforcement regime of our existing labor standards in Oakland. So this slide talks about the ways in which this law expands on the uses of emergency paid sick leave. So as you can see here, the FFCRA allows you to take your emergency paid sick leave for 6 uses. The Oakland law allows you to take your leave for those uses and then adds a bunch of other uses. And a lot of these uses, as you can see, have to do with if you have caretaking responsibilities. So if you're caring for a family who's been diagnosed with or experiencing symptoms of COVID-19, or if you are in some kind of high risk group. So if you're elderly, if you're over 65 years old, if you have some kind of health condition that could weaken your immune system and therefore put you at higher risk, if you have any condition that is certified by a healthcare professional as putting you at higher risk or as putting the public at higher risk. So you can take so in Oakland, you can take your emergency sick leave for all of these reasons. So this is one way, this slide talks about one way in which we try to make up for one of the major shortcomings of the federal law. As you can see here, and as Kathy mentioned, if you are taking your emergency paid sick leave to care for yourself, the federal law allows you to to get paid out at 100% of your wage. However, if you are using your leave in order to take care of somebody else, or if you're using your leave because you're experiencing some kind of similar condition specified by Health and Human Services, then you only get paid out at 2/3 of your wage. And so for us, this was like a real shortcoming in the law. We work with a lot of low-wage workers who are majority women and women of color who are primary caretakers in their communities. And so there's a very high likelihood that many of those women will need access to leave in order to take care of somebody else. And if you're only paying low-wage workers at 66% of their wages, there's a very high likelihood that like workers have to choose between staying home and keeping their families safe and their communities safe, and coming to work to get their full wages. So we solve for that problem by saying that, by requiring that for all uses of emergency paid sick leave, workers get 100% of their wages. And so practically what this looks like, if you were to take a minimum wage worker in Oakland who earns $13.80 an hour, and that worker takes 80 hours of emergency paid sick leave to care for a family member, they would be compensated $729 under the federal law, compared to a little over $1,100 under Oakland law. And you know, that $300, $400 can be the difference for so many low-wage families. So the second way in which we try to close the caregiving gap is, again, as Kathy mentioned, the FFCRA caps you at $511 a day or $510 in the aggregate if you use your emergency paid sick leave to take care of yourself. If you use your emergency paid sick leave to take care of somebody else, the cap is much lower. You get capped at $200 a day or $2,000 in the aggregate. And so we cap compensation at that higher rate at $510 in the aggregate for all uses of emergency paid sick leave. And it's worth noting that like this really only impacts workers who make more than $38 an hour, just because so many low-wage workers are not making enough for this to really apply to them. And I want to talk a little bit about just compromises, challenges, and lessons learned. So we started this process of drafting the legislation with our council, with our sponsoring council member, like back in March, and it took us 2 months to get this passed. And a lot of that just had to do with the fact that like city council was still trying to figure out how to align. There were meetings being canceled. They were having difficulty meeting quorum. A lot of that has gotten regularized at this point, but it was like a major hurdle for us. The second major compromise and challenge was that this law ended up exempting small businesses with less than 50 employees. It's worth noting that small businesses with less than 50 employees, unless they seek a specific hardship fund, hardship exemption, do have to abide by the federal law. So it's not that small businesses, for the most part, are like completely exempt from the federal law. But we had a very difficult time making the argument that they should be included in the Oakland law, because if you look at some of the ways in which we expand on the FFCRA, it would add extra costs that businesses have to absorb. So if you look at, for example, the uses of paid sick leave, businesses can get reimbursed at 100% by the FFCRA for the uses that are allowed by the FFCRA in the form of a federal tax credit. However, for the uses that the FFCRA does not allow, but Oakland law does, they can't actually claim that tax credit. So they have to bear the full cost. Very similarly, like this wage replacement that we try to solve for, the extra 33% that workers are receiving has to be borne by the business. And we try to make the argument that, you know, there's the Paycheck Protection Program, there are these other sources of SBA funding that employers could use, but it was also true that that businesses were not able to access those funds at this time. And so ultimately, like, small businesses ended up getting exempted from this law. I do want to really highlight this because this was like a really big compromise in the Oakland context, because in Oakland, 50% of all workers work for employers that have less than 50 employees. And 90% of Oakland businesses have less than 50 employees. So these numbers do include franchises, since technically franchises are considered like small businesses. So the numbers are overall probably less, but the point remains that I think we do feel like the effectiveness and the coverage of this law is severely compromised by this exemption. And a couple of the other kind of compromises and challenges were we ended up having to exempt the city of Oakland just because of budgetary concerns, and city unions just felt like this was lower on their list of priorities. We did encounter a lot of, not necessarily resistance, but did have to have a lot of back and forth with Kaiser and other nonprofit healthcare employers. So healthcare is one of the largest industry sectors in Oakland. It's one of the fastest growing, and Kaiser in particular wields a lot of political power here, and they employ 12,000 workers. And so one of our biggest concerns was that they would make use, so I guess to go back, the federal law, as Kathy mentioned, does have an exemption for healthcare workers and emergency responders. We retained that exemption in this law. We didn't want to do that, but it just felt like it was too politically risky otherwise. And the healthcare unions that we worked with had largely struck their own deals through collective bargaining agreements. And so, but one of our concerns was that Kaiser, which employs 12,000 workers here because their headquarters is here, would basically try to classify workers who are not on the front lines as healthcare providers or emergency responders in order to exempt them. And if you go and you look at the Department of Labor guidance on how you define a healthcare employee, healthcare provider, it's somewhat broad. Like employers can definitely try to massage how they interpret this. And so we solved for this in the ordinance by basically requiring that if Kaiser is going to seek the exemption for some of their employees, they have to produce a list that clearly identifies who the exempt classifications are and what the non-exempt classifications are. They have to make that list available to the city upon request. So this was our way of really making sure that one of our largest employers is following the spirit of the law. The other thing is we do allow a partial exemption for employers that already provide 160 hours paid personal. So that can be some combination of sick leave, personal time, PTO. 80 of those hours must be for immediate use. We are really thinking about this as it's really an exemption in name only, because employers have to follow all of the ordinance's requirements for the expanded uses, the wage replacement, and the compensation, and they're subject to the ordinance's enforcement regime. So ultimately, the extent to which they're really exempt is really limited. But this was something that was pushed by, in particular, Southwest, which is another large employer in Oakland, and we needed to make some compromises, even if it was a nominal compromise, in order to get the council member who represents that district where Southwest has workers to vote for this ordinance. And then the final thing I'll just note is this law passed March 12th. We're at the end of March. And I think we're starting to see a lot of just challenges that come with implementation and enforcement. Our city one of the things we're just hearing is that our city's compliance department doesn't know how to do this kind of emergency outreach. They don't have the infrastructure set up to reach out to businesses on a really short timeline. They don't know how to conduct investigations when you can't go in person to investigate someplace due to shelter-in-place orders. And so there's a lot of limitations we're finding with just how do you actually enforce a law like this. And to the extent that we are able to get things enforced, it's really because we have organizing power. So the sectors where we are in partnership with worker centers and labor unions that are actively organizing, hotels, restaurants, day laborers. We're finding that like workers are learning about their rights, and they are, we're educating employers, and that like if we need to, we're able to file complaints with the city or take it on as like through civil enforcement mechanisms. But workers who are disconnected from these organizing efforts are not necessarily like reaping the benefits of the law. And so I do think this is something that we should all be grappling with as we think through like statewide action. So yeah. Oh, and then the last thing I just wanted to know, and I think Jeffrey will speak to this more, is that there have been like successful efforts to pass local emergency paid sick leave ordinances in a number of places in California, Oakland, San Jose, which we'll hear about in a second, San Francisco, Los Angeles, and the city of Los Angeles and LA County. And for folks who are interested, the LA County ordinance, I think only applies to unincorporated areas, not incorporated cities. So that's what I got.
Great, thank you so much, Divya. That was super informative and really exciting. I think we have, Jeffrey has a hard stop at 1:30. I know we have a couple questions. So what I'm gonna do is actually switch over to Jeff, if that's okay with everyone, and then we'll pose the questions at the very end. Jeff, are you on the line and ready to go?
Yeah, let me do the screen share thing.
Great.
All right, well, good afternoon, everybody. My name is Jeffrey Buchanan, and I'm the policy director at Working Partnerships USA. I'm going to talk a little bit about San Jose's emergency paid sick leave ordinance. So Working Partnerships, we're a bit of a blend of a community labor coalition and a policy think tank. So we've been operating for 25 years. First, we started off as kind of the policy wing of our Central Labor Council, the South Bay Labor Council. And so really most everything we do is in partnership with our union allies, but also then our community allies. And so I think and also we're kind of the sister organization to eBase and some other organizations across the state that are similarly looking at many of these kind of worker issues and equity issues in the face of COVID through a national network, the Partnership for Working Families. But anyways, we've been working on issues of inequality, of democracy, of equitable development, but really workers' rights issues are core to our work. Over the last 5 years, we've formed a campaign working with some of the largest service worker unions in Silicon Valley. So that's, SEIU, USWW, Unite Here Local 19, and the Teamsters, working in particularly on service workers in the tech industry, helping them to be able to get better wages, get better health care, get better paid leave. In total, we've helped to organize, I think, an additional 8,000 service workers in the tech industry in Silicon Valley into unions and, much better compensation and wages, to the point where, as COVID came and shut down all of the tech industry offices, we were able to negotiate out agreements to be able to continue having all those workers paid, continue having their health care paid for most all of the largest tech companies in Silicon Valley. But we're going to talk a little bit about paid sick leave in the city of San Jose. So big shout out to the Santa Clara Public Health Department for anybody who's on the line from Santa Clara. Going to borrow one of your infographics. So I think very early on for us back in March, when we were first, learning what was going to be happening with, or how COVID was really developing, and starting to think through what does that mean for low-income workers, communities of color. What do we really need to be thinking about in the city of San Jose? So that's, basically here and here. We have an overlap of, low-income service workers that are concentrated, primarily in our city's east side, where you also have, overcrowded housing, multi-generational households, a lot of different risk factors that pile up for an infectious disease like COVID, and hearing about the need to quarantine for 14 days, we were struck by the fact that we are also the only of the California's 4 largest cities that doesn't have its own paid sick leave policy above and beyond what the state of California has. And so I think very early on, we realized that we got to figure something out on paid sick leave. And this was about the same time as the Congress was starting to think about what a federal policy would look like. And so, well, this is kind of jumping ahead, but in our story, we on March 12th, we worked with 3 of our city council's leaders, 3 Latinas on our council who have been really strong on a number of equity issues, really leading the charge. And so that's, Councilmember Maya Esparza, Councilmember Sylvia Arenas, and Councilmember Magdalena Carrasco to introduce a paid sick leave policy that had 2 prongs. One was to enact an emergency paid sick leave policy that I'll talk a little bit more about in a second. The other was to hopefully to get a long-term policy to adopt something along the lines of what Oakland, San Francisco, Los Angeles, and San Diego had adopted to allow for the accrual of paid sick leave over time. So we set out with both wanting an emergency policy that would provide for immediately that 14 days of paid sick leave that people need to be able to isolate and quarantine safely, and then for this longer term policy. In the end, we were not successful in securing a long-term policy, but we were successful in securing an emergency policy. And so similar to, as Divya described, we were building off of what had already passed, the Family First Act, and looking to fill the gaps. And so the San Jose ordinance is very explicit about filling the gaps. It basically, it reads and says, if you are not covered by the policy in the federal policy, you are being filled by this, either through being a business that has 500 or more employees, or for those that have 50 or fewer employees, to be able to fill the gap where you would be able to voluntarily exempt yourself from providing that family care portion of the federal policy. So that was that 2/3 pay for if you are caring for a child who's dealing with a school closure or a preschool closure. So this would very explicitly fill that gap, and it would also fill the gap of the first responder and hospital worker, healthcare worker exemption of the federal policy. And so we've been pretty happy that we've been able to cover a large number of workers. We weren't able to get our hands on data about what really the needs look like for who lacked paid sick leave beyond the state provided 3 days. But we did have a study back before we passed the state policy that showed pretty explicitly that, the types of workers in in the city of San Jose. Let's see if do I have it teed up? Maybe I don't. This is the problem with the. All right. Anyways, I thought I was going to have a nice figure for you that I'd throw at you, but about 1 in 3 workers before the state passed its policy in the city of San Jose didn't have a single day of paid sick leave. And for food workers, for folks in transportation, construction, personal care, all these essential workers, over 50% of those workers in San Jose did not have any additional paid sick leave. It was like half of Latino workers in the entire city at that point had no paid sick leave. And so all these things stack on top of each other, reasons why, we decided to pursue the policy we pursued. So similarly, we structured the payouts and the caps similarly to the federal bill. And then similarly to the Oakland example, worked very explicitly to tier off of the California Labor Code, particularly what it passed with AB 5 last year, to be able to cover gig workers. Our organization, through an effort called Gig Workers Rising, we've been trying to organize thousands of gig economy workers to stand up for their rights, particularly here in the Bay Area. And the horror stories of folks being sick and having to work, not able to be able to access PPE, not being able to access the programs that the companies have announced that are supposed to be like paid sick leave but don't actually function. Making sure that if folks have symptoms, if they have a doctor's note, having that kind of government enforced policy on the books, we thought could really mean a lot for workers. And so again, we first announced our attempt to be able to put in place both an emergency and a long-term paid sick leave policy back on March 12th, introduced it with a pretty wide coalition of partners. The leads of our Association of Community Clinics, the Silicon Valley Health Trust, representatives of the Minority Small Business Consortium, housing groups, folks representing social services and food banks, just a wide coalition of folks, really, because I think everyone at that point was seeing these connections between the public health goals that and our healthcare providers were really on the front lines of providing for, and the fact that we have so many low-income workers, even in a rather wealthy city, we have pockets of immense poverty. And so how do we help these essential service workers? And so announced the policy on March 12th, started to roll out a number of worker stories, doing a lot of earned media, and then the policy ended up in its first kind of hurdle before our rules committee, which is essentially the committee in the city that looks to decide what goes before the whole council and can actually be voted on, and ran into some roadblocks. Our mayor, our Chamber of Commerce, the Silicon Valley organization, some others really came out hard attacking the policy. And that's when we saw really the kind of the small business argument was going to be the biggest barrier to being able to move forward on a policy. And so, at that point, we really started to try to educate our mayor, educate our council members about the benefits of the Families First Act, which was near passage at that point, in terms of providing fully refundable tax credits that on a quarterly basis would allow a small business to be able to essentially pay for whatever they're spending on paid sick leave and get paid back on a quarterly basis. And, it actually helped us to really break through in walking through that process, because we had some small business owners on the council who understood, even if your business closes up shop, you're still paying that quarterly payroll tax. And so no matter what happens to you, at the end of the day, you're going to get paid back for what you're spending on paid leave. And so over time, we were able to educate council members on that and really break through some of the misinformation coming from some of the business associations in town. And that was really an inflection point for us. I think in the COVID world, we also found in campaigning that everything's very different. Like, we're used to being able to go out on the doors and talk with families, talk to people in workplaces, to do mass meetings. None of that was really possible. Even a press conference, you had to stand 6 feet apart from each other. And so, really trying to think about what is communicating with people that your constituencies and through digital means. That really became a key part of what we needed to do. And then also just, in the end, you can have all the best data and arguments and information in the world, but in the end, it's a set of political decisions. And so really trying to shape out that the federal policy, as Divya mentioned, covers a lot of small businesses in many ways. There's some exemptions, the care provision, that there's a possibility of an exemption, but who was really left out in the federal policy was those large corporations. And so standing in the way of an emergency paid sick leave policy, where small and medium businesses can get paid back for dollar for what they invest in paid sick leave. Really, it was certain political leaders trying to protect corporations if they were going to stand in the way of such a policy. And so we really made an emphasis on trying to call out that issue, and realize there's probably some organizations here on the phone that maybe aren't as political or kind of campaign oriented, but we found that to be a really effective tactic in being able to move forward this policy, that kind of twin strategy of educating people about ways to mitigate the impact on small and medium businesses, and then calling out that it was really the corporations, the big corporations, who were benefiting from calling it out. And also in using small business validators to make the case. So you'll see over here in the top left corner, this is Reverend Reginald Swilley. He's the head of the Minority Business Consortium. Really made an eloquent case of hey, if I'm a small business owner and I'm keeping my doors open, if someone comes in sick, I want to send them home, because if I'm a small business, I may have only, you know, myself and a couple of employees working on any given day. The chance of yourself or other coworkers getting sick, you can shut a whole business down. And I think the data really looking back at the H1N1 virus and the experience of that disease, you know, you saw like 1 in 3 workers that were sick reported going to work despite having symptoms. And something like another 8 million people that got infected because of that is the estimate in the research that's out there. And so it's pretty clear, you know, in this scenario, what the economic case for even a small business is. But I think, you know, it's really how do we really define that? So again, really in terms of lessons, you know, thinking about how do you deal with this small business case, thinking about how to engage a wide variety of stakeholders, coming up with beautiful imagery, and in our digital engagement life, you know, we find that you really got to have good imagery to kind of motivate people to engage on policy. And so we were lucky to actually have an artist in residence that helped us through the campaign to make cool graphics like the one on the left. I think what we've seen so far, we were able to win and get it out there, but we've been struggling really to educate workers about it. I think because of perhaps some of the politics that were around passing it, we haven't had as much support from our city administration in really educating workers about this. We have had some success in getting our county, which, you know, through its ability to reach businesses that have a health permit, to be able to really reach out to the restaurants and food service vendors in the city of San Jose about how this policy works and how to really move forward with it. And we've gotten the city to do some outreach, but we're hoping to do, you know, really to ramp up, especially now as we're looking at opening up more retail and food service and other types of businesses, really trying to make sure that folks are educated about what their rights are under this policy. And, you know, through our budget process, despite, you know, the tough times in our city, trying to see if we can win some additional dollars for staffing for that labor enforcement arm, our Office for Quality Assurance. So thank you so much. Sorry for the short and quick presentation, but really appreciate the opportunity.
Thank you so much, Jeff. And I know you have a hard stop at 1:30. Do you want to take one quick question, or do you have to hop off?
Yeah, no, glad
okay.
to if there's.
We'll take one quick question specifically for Jeff, and then we'll open it up. And I've been fielding a couple questions through the chat. So anybody have a question about the San Jose ordinance? I see one in the chat. I'm guessing it's for you, Jeff. Any potential to pursue countywide?
Yeah, I mean, we've had a couple of conversations about that. I mean, I think for us, the unincorporated part of the county, other than the area around in Santa Clara County, other than the area around Stanford, there's not a huge amount of employers in our unincorporated area. And so, you know, I think if we were to pursue one in Santa Clara County, it would probably have to be, you know, through the emergency and, you know, as described earlier by the gentleman from Change Lab. And so we've started to have that conversation and talked with some of the smaller cities in the county as well. We're still trying to work on that front. But really, you know, AB 3216, the Ash Kalra's state bill that was described earlier, we're putting a lot of energy in that because, you know, that would be an even better approach, I think, for our county. So.
Wonderful. Thank you so much for being with us and for sharing all the exciting updates from San Jose. And hopefully this can help a lot of people on the line thinking through their own jurisdictions, moving this policy forward. So I appreciate you being here.
Right.
We'll start at 1:30. I'm going to let you go. Thank you.
Right. Thanks, everybody.
And for those who have to hop off, totally understand. We have a couple questions that came through the chat as folks are presenting. So I'll pose a couple, and whatever we don't get to today, I will post to our speakers via email and make sure to include it in the resources that we send out to everybody. So I'll open it up to the panel, and I'll start with this question. And this came through while you were speaking, Divya, so I'm not sure if it was particularly for Oakland or not. Do I understand that a worker with an underlying chronic health condition or over qualifies for 80 hours paid leave, even if no other symptoms or issues exist? If so, after 2 weeks, must they return to work?
Yeah, so this is specific to the Oakland ordinance. Yeah, so one of the reasons that a worker can take their emergency paid sick leave is if they have an underlying health condition, one of the ones that is enumerated in the slide that I showed you. And these are conditions that that our county health department has identified as conditions that can make you more susceptible to COVID. Or if you are 65 years or older, or if you have some kind of condition where your healthcare provider has said that you are going to be at risk. You can take your full 80 hours of leave just for that reason. So you don't need to have been in contact with someone who has COVID. There's simply you being in a high risk population can enable you to take this leave. Yeah, so I mean, it is true that like after 2 weeks, like they only get that paid leave for 2 weeks. And again, this is just because we needed to track with the federal ordinance, but we do think it's still useful. And the reason is that if you belong to like a high risk category and there's an outbreak at your work, or there's an outbreak, you know, in your community, that could increase your chances of exposure, there's an opportunity there for you to stay at home while things are like sort of blowing up, and hopefully you'll be able to wait out, you know, the surge. So that's the kind of thinking there. It has limitations, obviously, but we still think it's an important. We still think it was really important to be able to protect people who are vulnerable.
Great, thank you. I want to be mindful of everyone's time, so we'll take one more, and I know we have 2 more questions that came through, and so I'll circulate those after. I think this is an important one because it kind of follows what happens after the policy is passed. And the question is, with the passing of the paid leave, how is enforcement verified? And I'll open this up.
Yeah, I can answer this with Oakland. So our law does require that the city issue a notice to all employers within 15 days of the law being passed. And so we're working with our city administration on making sure that they issue this notice. The thing is that historically, the way they would have done this is they would have just mailed you a poster, you know, that you just put up in your workplace. That's not necessarily adequate notice in this day and age. So really trying to think through, like, what is the infrastructure for outreach and for posting notice is really important. The second thing is our law does require or does allow for multiple forms of enforcement. So you can get administrative enforcement through our compliance office and our Office of Labor Standards Enforcement. You can also pursue civil enforcement, private right of action, or you can file a complaint with the city attorney. And the law does require that if somebody files a complaint with the city, so through the administrative process, the city has to acknowledge that complaint within 1 week, and they have to investigate and close the case within 2 weeks. And so that's our way of making sure that like the emergency part of this emergency paid sick leave ordinance is actually being upheld. And then the last thing I'll also say is that we are pursuing working with our city attorney to establish guidelines that will further clarify certain parts of the law that still are somewhat ambiguous. And so we're really focusing on, like, as employers start to reopen, where are these like moments where the particular circumstances of reopening, like they're, you know, it's unclear exactly how the law would apply to certain groups of workers. And we're encountering this particularly with part-time workers. Both the federal law and the Oakland law, which tracks with the federal law, leaves open some questions about how you account for hours for part-time workers who have fluctuating work schedules. And so on some of those issues, we're working on establishing guidance. Mm-hmm. But the last thing I'll just say is I think the best way that you enforce laws is if you have organizing power. I think at the end of the day, like, these are very complicated laws, and like, you know, your average worker just like won't understand what the law is and what the remedies are unless they're connected to some kind of power building group. So I think, yeah, I just want to really make that case.
Great, thank you for lifting that up. I think that's a theme we've been seeing with a lot of the presentations today. I appreciate that. Okay, I think that's all we have for time, and I apologize we cut the Q&A a little short. We're still trying to manage having such great content and great speakers, and also enough time for everybody to ask questions, but I promise I'll circulate all these questions that I'm getting, and we'll send those out to you. I want to say thank you to all of our speakers today for carving out this much time, and to everybody who attended. I know 1.5 hours does not come by easy in this day and age, so I really appreciate you all being here and for all the great content that you shared. And again, please reach out to us if you need any support in advocating for your own jurisdiction in passing similar laws. I'm happy to connect you with all of our speakers today and their coalitions and efforts as well. Thank you all for being here. Enjoy your weekend coming up, and hopefully we'll see you on other discussion topic webinars very, very soon. Take care, everybody.